Antenatal care is one of the benefits that a pregnant woman can get during her pregnancy and post-delivery. And today we want to discuss about antenatal care in relation to this particular booklet. And the reason why I brought this particular topic is that mostly you find that a woman is coming while in labor. She has the book, yes, and there is nothing filled in it except some particulars and few attendance or no attendance at all. And this one is a great challenge to each and every health worker and also the mothers who are normally attending antenatal care. This book needs to be filled from the beginning up to the end. And in this discussion, when you are pregnant, the Ministry of Health recognizes you and even congratulates you in your pregnancy. And it says, "Dear father and mother, congratulations on this pregnancy. The Ministry of Health would like to celebrate with you and present this mother and child health handbook to you. Please read well together with family members and understand the contents well. And if you have a question, please ask a health worker or a community health volunteer without any hesitation." Meaning that Ministry of Health recognized your pregnancy and even they have introduced Linda Mama, which normally helps you during your pregnancy up to delivery and postnatal up to around 3 months without paying anything in any hospital you attend in Kenya. And this handbook will be used during pregnancy, childbirth, and after childbirth until the child is 5 years of age. But we find that when a woman has brought the child up to around 9 months, they normally disappear and they don't come back. And you know very well, this book, there's an important part that most of us do not understand. And I want to make it very, very clear in terms of reading what it entails. Please keep this handbook safe and hand it over to the child when he or she grows up to adult as a present with instruction to keep it safe. How many people around here in this my community did you hand over this book to your child, or did you receive this particular book from your parents when you are an adult? Please put the comments down here so that we can congratulate the family members who did pass this information and this particular booklet to their children when they are an adult. And this book, normally if you pass it over, it will show the love of your mother, the way she was taking care of you, and the love of your family, the way they were taking care of you from the birth, from the pregnancy up to delivery, and all the vaccinations and all sickness, and the way they were treating you well, and the way even the health workers, the healthcare providers were treating you in terms of your sickness, if any. And in today's video, we want to talk about the part fathers should play, because we find that most of the women, when they are pregnant and while they're in labor, there's no parent, there's no father present. They struggle alone, and most of them undergoes psychological torture and even develop what we call postpartum blues. They will develop postpartum psychosis because there was no emotional and physical support of their partner. Now, in the part of the father's support, it is well indicated in this book that fathers should give support in different scenarios. And the first support is during pregnancy, second support during childbirth and afterbirth, and even when deciding on the method of family planning. Now, what are we supposed to do as fathers when our wives or our spouses or our fiancés are pregnant and they have been given this book, and we need to take care of this pregnancy. Now, during childbirth, we are supposed to be showing your wife or your partner that you care about her, can help her both physically and emotionally. We should be there for them. We should be taking care of them. We should be showing them that we love that particular pregnancy. This will help to nurture the growth and development of the fetus in utero. Now, make sure she has help with her work in the house. If you cannot do some of the work, get someone to do it. Some people normally engage their pregnant wives with difficult tasks. They get tired, they cannot do anything, they develop emotion breakdown because of too much work versus the pregnancy they have. So as husbands or husbands out there, you should be listening to this and particularly help your wife when she is gravid. Now, make sure she eats healthy food, that is balanced diet, and goes for antenatal care at least 4 times during pregnancy. Accompany her as much as possible. Now, this is a challenge to most of our women who are pregnant, that they normally attend antenatal care sometimes once, sometimes they don't attend at all, but you are supposed to attend at least 4 times, and your husband should accompany you to the clinic. There are very many things that we do in the clinic, and we will learn them as we proceed with this series of videos about antenatal care. About balanced diet also, we'll talk about what type of food that we should be giving our wives when they are pregnant, so that to help to nurture this pregnancy and to help in growth and development of the baby intrauterine. Of course, when you go to the clinic, when you have been accompanied with your husband, you will be counseled about HIV, you will be tested, and even you will be screened for sexually transmitted infections. Those ones we will discuss in the next series when we'll be discussing about antenatal profile. And during childbirth, what are we supposed to do as father? You can help your wife have a safe labor and childbirth by 1. Making sure there is water and food in the house to avoid any worries as she goes to deliver at the health facility. You know, women are the head of the house, if you don't know. And if there is no food and she is labor, she's even worried of the children she has left behind, if there was any. And as a husband, you should be able to provide those particular food. Make sure transport to the health facility is available. This is what we call birth plan, and I want to talk about this birth plan into details, because we normally find that a woman comes to the hospital, she delivers, she doesn't have anything about the baby, no clothes, no towel, no nappy, no even oil to assist the baby skin. Now, what is this birth plan and how can we talk about it? Now, birth plan is not the preparedness you as an husband and the wife you normally do before you deliver. Once a woman is pregnant, there are some things that you are supposed to put in place in terms of 1, due date. You will be told into the hospital that this is your expected date of delivery. You should put that one into the account, and who will attend you, the hospital you will be attending to, and the baby material, baby items, clothes, baby soul, everything to do with the baby, you should be buying them in prior. I know there are some taboos and traditions going around in each and every tribe in this our nation, but I'm urging you that those ones do not apply in birth plan. Buy those items prior, even the basins, even the soaps, even the oil. Buy them, keep them in prior. Then this one will really assist you. And in this relation, you should be working together. You should even be having contacts of the facility that you are going to give birth to. In case of emergency, you can call and ambulance can come and pick you. Save some money, because pregnancy is like an emergency. It can come anytime. Some people do not know even when the labor comes, particularly when it's a first time, a prima gravida pregnancy number 1. It can come at midnight. If you don't have even money or contact of anyone, it can be a very, very big trouble. So have this birth plan in place. Transport, money, baby items, where you are going to give birth, the person whom you want to accompany you, if it's your husband, yes, let him accompany you during this particular time of labor. Now, take care of other children, if any, or getting someone to take care of them. I thought that one we have talked about. If you stay with her during the birth, you can help by giving her both emotional and physical support. We've talked about that. Encouraging her by telling her she is doing well. You know, labor is like breaking bonds into your body, physical breaking bonds. This woman is in intense pain, and we cannot even give painkillers for this. Some normally cry, give me even paracetamol, give me something, but it is a natural process, and your husband should be there to accompany you, to tell you it is well, you will give birth safely, to rub your back. You see, those are needed for husbands, and helping you walk, squat during contraction, and even rub your back, as I've said. Now, after birth, this is what we call puerperium, the first 6 weeks, when you've delivered, and now your pelvic organ, your reproductive organ is going back to non-pregnant state. That is what we call puerperium. Now, what are we supposed to do as the fathers or the husbands? Now, one, the first 6 weeks after birth are the most important time for a woman to feel strong and healthy, and for the baby's survival. Now, a lady needs to have humble time of sleeping and breastfeeding the baby. Do not put your wife with a lot of stress. This is why government thought it wise to give out maternity leave, that is paternity leave for the men like us, that if your wife has delivered, you should be giving some 2 weeks, at least 2 weeks, to help your wife in the house so that she doesn't develop emotional stress or postpartum psychosis. Of course, if the child is HIV positive, there are some drugs, there are some ARVs that we should be giving at least from 6 weeks. This one we will do counseling, and in this scenario of the drugs that are given when a mother is HIV positive and the child is exposed, we will talk about this in the coming series. Now, this is now very, very important. Avoid sexual contact until the bleeding and discharge that comes after develop. That is lochia. Some patients we normally get, and this is very, very sad. Men, kindly listen to me. We get that a woman goes to the hospital in labor, delivers well, she developed tear, she's being sutured, that is episiotomy, it's made, and it's being sutured in the vagina where the tear developed during delivery. But you find that the way the tear is still very, very fresh and painful, some do involve into sex until that place that was sutured, the vagina, gaped away, and they're now coming back when the vagina is not in good shape. Please, men, wait until your wife has healed completely. That vagina is yours forever. So when healing will take place, you will be able to do it 4 times, 5 times, even 100 times the way she liked. So give her time to heal. And this is a very candid message to all fathers that are watching this video, and all our wives and all the ladies who are pregnant. Keep this one into mind and give your husband time. Now, family planning is also key in this particular topic, that fathers should offer family planning when they have the wives have delivered. Offering family planning, meaning that you should be able to sit down together and discuss about these methods of family planning that you are going to use, the wife is going to use. Because sometimes we get patient women come for family planning when their husbands are not aware, and they normally come, they make noise. Why did you do this? Why did you do this to my wife? Now, family planning is very, very important, and child spacing should be also be encouraged. In fact, the government, this is what the government wants you to do. To have healthy mothers and babies, it is the best to space your children at least 2 years between pregnancies. 2 years between pregnancy. This will help your body to come around. You know, if you delivered each and every year, your body will be worthless. Your body will not function as the way it is. That's why some women, they have children with 1 year spacing. Even some are not even 1 year. Some are almost 8 months. And they have another pregnancy. So child spacing is very, very important. At least 2 years. Some clinicians and some medics normally say 5 years spacing, but now the government wants you to at least 2 years. This will help you to prepare your body, to nurture your body, and when you eat well, you will be able to carry the next pregnancy very well, and this may avoid even miscarriages. You can help your family be more healthy by using family planning, and visit the family planning clinic with your wife and decide together, as I've said, which method will work best, and share the responsibility for using it. Now, fathers, this is very, very important. When we have this booklet, when your wife has this booklet, you should be able to sit down together and go through it. This idea of people coming to clinic and they have only this part and maybe one attendance of antenatal care, and you know pregnancy has complications. There are things that we can diagnose during antenatal care. These ones we will be discussing in another series. If you like this video, please hit the red button written subscribe, turn on the notification for the series that will continue of antenatal care. And also, if you love this channel very well, donate via this M-Pesa number and also via PayPal button that is written into description. And if you have any question about the further support, please write your comments down here so that this discussion will be very, very lively. See you in the next series of antenatal care, and may God bless you. Muchas gracias.